Okay, I'm going to get us going. We still have people signing on, but I want to get started because we have a really excellent day. So good afternoon, everybody. My name is Sandro Galea, and I have the privilege of serving as Dean of the Boston University School of Public Health. On behalf of the school, welcome. Before we, a word of thanks to all of you who are joining us today, and a word of thanks to everybody who made today happen, in particular Meredith Brown and Alicia Noel, who are behind this series. Thank you. This seminar is part of our weekly series about COVID-19, where we as a school have discussed the science of the pandemic, its mental health consequences, and its intersection with politics. As time passes, it becomes clear that one of the most lasting effects of COVID-19 will be the consequences, not so much of the disease itself, but of the steps we have taken to mitigate it. These long-term effects will have significant implications for public health. But the day-to-day unfolding pandemic has provided little space for thinking about them. This event is meant for space. We are truly lucky to have with us a panel of experts to help explore what the present crisis means for our future health. Each panelist is going to speak for about 10 to 12 minutes and shall moderate questions from the audience. Please feel free to use the question tab in your Zoom browser, and I will do my best to get to as many questions as we can. Our first speaker is Professor Janet Currie, Henry Putnam Professor of Economics and Public Affairs at Princeton University's Woodrow Wilson School. Professor Currie, over to you.
Thank you. Share screen. Go. Okay, so I just want to say that there's so much uncertainty about COVID-19 that I was happy to be asked to talk about something where I think we do have some certainty about what the likely effects are going to be going forward of all of the economic catastrophe and so on that's accompanying our fight against COVID-19. So I'm going to talk about three categories of effects. One are the in utero effects on the developing fetus of everything that's going on. A second is the effects on health behaviors. A third is the health effects of economic shocks, both in the short term and in the longer term. And then at the end, I'm going to talk a little bit about possible lessons going forward. So what do we know about the effect that COVID-19 might have on the developing fetus? We don't actually know that it will harm the developing fetus, but we fear, based on what we know about other diseases, that it might. So for example, COVID-19 has been compared to influenza, and we know that the seasonal flu causes prematurity, and you can see that in this figure where you see a dip in gestation length for people who are conceived in May, and that's because they come close to term in the fall when flu is very prevalent. That's what you can see on the right-hand side here. So it may be directly harmful to the fetus. What we are more confident about is that stressful events during pregnancy have a harmful effect on the developing fetus. And there are many studies that show this. The map here is just from a study that I did, which is looking at hurricane paths in Texas. And what we showed was that women who lived along the projected hurricane path were more likely to have abnormal conditions of their babies at birth. So that's just one example, as I say, of many papers. We also have heard that there's been a spike in domestic violence because of the lockdown. And we know that the fetus can be directly harmed through assault during pregnancy. One of the things that it does is to cause preterm labor. And this figure is from a study that I did in New York City, looking at or seeking to quantify the social costs of these premature births due to violent assaults. We also know that economic stress impacts health behaviors and can lead people to drink more. Some reports have said that alcohol sales are up 55% in the United States. People also smoke more. People who had quit smoking may relapse. People who use drugs may start using more drugs. And these are all effects that have been documented. For example, in the Great Recession in 2008, many people responded this way. Whether it's because they're under the most stress or for other reasons, these effects tend to be greater among minorities, unmarried mothers, and less educated mothers. There's some evidence from the Great Recession that more advantaged women actually experienced some improvements in mental health, which seems a little paradoxical, but these events, as we've seen, tend to exacerbate existing health and economic inequalities. And it seems like the COVID-19 crisis is going to be no exception to that rule. We also know that COVID-19 is directly impacting the use of preventive services. In fact, it's pretty much impossible to see a doctor right at the moment for regular preventive care. There's concern that postponement of vaccinations for children may lead to some children being not vaccinated, both in the US and abroad. Also, we know that failure to receive necessary preventive care for conditions like diabetes will land people in emergency rooms. So this is also very concerning. There is an economic literature documenting the types of effects that economic shocks have on health. This figure is from a study that I did looking at foreclosures in the 2008 crisis. As you may recall, a spike in foreclosures and the collapse of the housing market was one of the things that precipitated the crisis. And in areas that had more foreclosures, you saw more hospitalizations for these kinds of preventable conditions that I was talking about, like diabetes, hypertension, also asthma. And that was because people were forgoing the care that they needed as a result of the economic shock. And you also saw more hospitalizations for mental health conditions, spikes in admissions for anxiety, panic attacks, suicide attempts, and other mental health conditions. So we should also expect to see more of those sorts of conditions. Also, in the long term, these things take their toll. This figure is by some very interesting work that's followed cohorts of Americans from the year they entered the labor market and shows that people who entered the labor market in times of high unemployment have higher mortality many years later when they're 40 or 50. The higher mortality is mostly due to disease, not external causes or accidents. And breaking it down a little further, this figure is showing that most of those deaths are from lung cancer and heart disease, especially heart disease, although there's also an increase in what has come to be called deaths of despair from suicide, drug overdoses, or conditions like cirrhosis. So these things take their toll over many years and lead to higher mortality rates down the road. So one question in this very grim time is whether any good can come from this crisis in terms of improvements in future public health. And I think that depends very much on whether we draw the lessons that are so obvious right now and remember them when the time comes to invest in the future. The crisis really demonstrates the importance of having a strong public health infrastructure for testing, contact tracing, getting the message out. These are all things that were lacking in the initial stages of this epidemic. The CARES Act, fortunately, prohibits removals from Medicaid during the emergency, which had been going on at an alarming pace. This implicitly recognizes the importance of Medicaid as a safety net. The CARES Act also covers expenses related to diagnosis, treatment, and hospital care at Medicare rates. And so we now suddenly have Medicare for all. That is Medicare for all COVID-19 patients, but it shows that we can do it basically if we want to. And I think the bottom line here, which I'll end with, is just that we need coverage for all in order to ensure health for all.
Thank you. Thank you very much, Professor Currie. Next up is Professor Catherine McClean, Associate Professor at Temple University. Catherine.
Thank you very much. Thanks so much for this opportunity. I think what I will be speaking about will build on something that Professor Currie was just discussing. What I'm going to focus on is the long-term health effects of entering the labor market during COVID-19. And I'm going to look to evidence from the past. So this was touched on a bit in Professor Currie's talk, but I'm going to look at a different experience from the past when we can potentially also learn some lessons. So just what I want to talk about is what are these potential long-term consequences of entering the labor market during COVID-19? So when I say new labor market entrants, essentially what I mean is these are individuals who are leaving school. This can be from high school, trade school, college, or graduate or professional program. You may think that these individuals are maybe roughly 18 to 28 years. My deep theory that I'm thinking about is, as I'll discuss, labor market entrance is an important period for a wide variety of domains that are linked with health outcomes. These new labor market entrants had a plan. They were going to enter the labor market and they had careers and lives planned. Something really unexpected and awful has occurred. These plans have been disrupted. What might this mean for their futures, for this particular cohort that is entering the labor market now? In particular for their health, and also can we learn something from historic events? So just a brief outline about what I will be talking about. What happens at the time of labor market entrance? Why should this matter for Lifecourse health? What can we learn from the past? My answer is I think so. What is the evidence from the past? And I'll think about a recession that occurred many years ago. And what does this mean for the present? So there are important changes that occur when individuals are of the age at which they enter the labor market. There are so many, one might say, where might we think about even starting? Individuals are beginning to take on adult roles. They're completing schooling. They're beginning to pay down their student debt, taking that first job, making the first permanent job potentially, moving away from home, deciding to rent or purchase a home, considering marriage or cohabitation. Fertility choices may be considered at this time. There's also biological changes that are continuing to occur into the early 20s. The prefrontal cortex region of the brain is continuing to develop during this time. This has implications for how we might make decisions and how we might set health behaviors across the life course. So why might this matter? Well, let's just think quickly about jobs and families. There's a large literature that has suggested that initial jobs matter. That is, when you form a job, the first job actually matters. It can set your career trajectory in terms of the skills that you will gain, what potential future employers think of you. There's a large literature out there that suggests that people who leave school in an economic downturn have persistently lower wages and they work in less prestigious jobs. Early career is also an important time for family formation. Your job prospects, the job you have, may impact your marriage market, as economists like to say. This may impact whether or not you choose to marry. I've done some work where I show that individuals who leave school, in particular men who leave school in a bad economy, are less likely to marry and more likely to divorce later in life. Why might these things matter for Lifecourse health? There's a very large literature that links income and health. Those with individuals with higher income tend to have better health. And wages are a particularly important source of income for many Americans. Employment is also linked with health. The employed individuals tend to have better health than the unemployed, and we think that good jobs, those are jobs with high wages, good benefits, and so far, are supportive of good health, while bad jobs, which are the opposite of good jobs, may not. Family formation may also be linked with health. Those who are married have better health on average than those who do not. So knowing that leaving school in an economic downturn can impact many, many things for individuals that we think are linked with health, can we learn something about the past, learn from the experience of cohorts who left school and entered the labor market in poor economies, to learn something about the potential long-run implications of leaving school in COVID-19 and the potential recession that we are going to experience, and how that is going to affect this cohort of school leavers, how this may potentially persistently impact their life course health. So we've experienced several major economic downturns the past 40 years in the United States. I've listed some of them here. This is just information from the National Bureau of Economic Research. The first question might be, well, is the COVID-19 recession comparable to these previous recessions? I'll mention that later, but I want to acknowledge there will obviously be differences between this recession and potential and previous recessions. What we can do is we can look across time. Here I just plotted the average unemployment rate from the Bureau of Statistics from the years 1978 to 2008. I highlighted a specific period in time. The early 1980s recession, so this is 82 into 1983, and then was the late 2000s recessions, which Professor Currie has mentioned. What I'm going to do is I'm going to focus on the cohort of leavers who left school in this early 80.
Oh, sorry, Catherine. I was just interrupting because your audio was really breaking up. But maybe you're better. Right? Maybe you can come a little bit closer to the mic.
Oh, so sorry. Does that sound better?
Yeah, that sounds better. I think I think it's a Wi-Fi issue. I apologize to interrupt you, but
no, I'm so sorry. We don't have great Wi-Fi here.
No, it's okay. And to everybody, there's been a lot of comments. We're aware, but I think this is much better now. Thank you, Professor McClean.
Okay, so sorry about that.
Please go ahead.
So what I've done is this is just plotting the unemployment rate between 1978 and 2018. I'm going to focus on the cohort that left school in the early 1980s and track them over time and see what we can learn about their experiences in terms of their health. So, fortunately, we have a very rich data set that is collected by the Bureau of Labor Statistics. And what it's designed to do is to track labor market outcomes, health outcomes, and marriage outcomes, amongst other outcomes, for a cohort that left school around the 1980s recession. To follow these individuals who left school in the early 80s recession in studies and see what we can learn about their health across the life course. Again, I'm going to look at individuals who left school right around this time, thinking about people who left before, during, after this major recession in the early 80s, to see what we can learn today.
Catherine, try. I'm just stopping again just because it's the voice breaking up. And let's try a little bit closer to the mic. Thank you.
Okay.
Sorry.
How is that?
Yeah,
no problem.
Like that we can hear.
Okay. So sorry about this.
Just like that, if you can be closer like that. Thank you.
Okay. I'm a little bit. I'll stay like this.
Yeah, like that we can hear you. Please, yeah, like that.
Okay. So colleagues and I have explored the implications of leaving school in a bad economy by comparing those individuals who left just before, during, and after the early 1980s recession. And we've followed them through into the time in which they were so the thought experience between the two individuals. I left school in 1982 when unemployment was very high, 97%, and we followed them through to the 2000s. Another individual left school in 1979 when the unemployment rate was much lower, 5.9%. We will track these two individuals and see how they fare in terms of health across the life course. In general, for men, and women, in general, across a range of different outcomes, including mental health, physical health, risky alcohol use, sleep patterns, self-esteem, access to health insurance. We find individuals who left school when the unemployment was high have worse health than those who left school when the unemployment well, into their
Catherine,
40s and 50s.
Catherine, let me stop you for a second because we're having a hard time hearing you. May I suggest for a second, we can pause here. I'm going to
Sure.
go to Professor Siddiqi's presentation and we'll sidebar with you about the audio. Is that okay?
Sure.
Sorry, I know that's very disruptive, but
No
people
problem.
can't understand you.
No problem. No problem.
Sorry about this.
Sorry about that. So,
Oh, it looks like I can't screen share.
hold on.
Wow.
There we go. Now you can. So we're going to move on to Professor Arjumand Siddiqi, who is a professor at the University of Toronto. Arjumand will speak and we'll sidebar. We'll come back to the next half of Professor McClean's presentation. Sorry about that, everybody.
Hi, everyone. Thanks so much for having me, Sandro, and the Boston University School of Public Health, which is near and dear to my heart because I did my master's with you. Thanks for the chance to sort of present what I think is a way to frame what Professor McClean and Professor Currie presented. So I'm going to give an overview of what I think are the issues related to the life course consequences of what we will see emerge from coronavirus and the pandemic. So let me start with a background on the idea of life course epidemiology. The basic notion is that we have experiences in life, and those experiences affect us not only in the short term, but they effectively set us forth on a health trajectory throughout our lives. And this is a schematic that depicts that association. So on the y-axis, you see chronic disease risk. The higher you go on that y-axis, the higher your risk of chronic disease. And on the x-axis is time. So you're getting older as you go further down the x-axis. And you see two curved lines, one that says high risk trajectory and one that says low risk trajectory. And the basic idea is that there are differences in people's trajectories of health that are based on what kinds of experiences they have earlier on in life. So that kind of carries forward throughout the life cycle. And you can see that your risk for chronic conditions is greater when you have higher risk. Moreover, that risk sometimes tends to accumulate toward the later years. So it turns out that the biggest source of risk, if you boil it all down, is really from our economic conditions. And that's because those conditions tend to shape in a fundamental way our material and social security. And so in other words, if you think about who might be on a high risk trajectory or a low risk trajectory, that correlates really well with our socioeconomic position in life. In bigger picture terms, we see this playing out in population health outcomes. On the left-hand side is a graph from Raj Chetty and colleagues, and this shows differences in life expectancy trajectories for different income quartiles. And that yellow line is the richest quartile, and the blue line down below is the poorest. And you can see that by and large, over the years, everyone's life expectancy has been gaining, but that the rate of gain has been much higher for the high income group. And this has been happening, as the right-hand side graph suggests, at the same time that we see very similar patterns for income trajectories of different groups. So the high income group has been gaining at a much higher pace than the lower income groups in society. So these risk trajectories that are based on socioeconomics at the individual level seem to pan out at the population level as well, where we see people who are in low socioeconomic groups with less chance for health, those in higher socioeconomic groups with more chance for health. How does this play out? Well, we think it happens in multiple ways. And there's three main pathways that people talk about. One is called a latency pathway. And the idea is that what you experience earlier on in life can affect your health outcomes as an adult independent of what happens in the meantime, of what kinds of socioeconomic conditions you experience in the meantime. If you have an improvement in your income or education, there's a theory that there still might be an effect of what you experienced earlier on. The second is a cumulative exposure pathway, which means that the effect of your socioeconomic conditions over your life course accumulate to affect your health conditions over the life course. And the third is sort of a trajectory model that says the effect of your early life socioeconomic conditions affects your health because precisely it affects your socioeconomic conditions along the way. So if you start out with less income, the idea is your trajectory will be to stay lower income, and that's actually why your health is affected. So what should we worry about then in light of the coronavirus pandemic, knowing that socioeconomic conditions affect health throughout the life course? Well, I think we should think about what sectors of the economy are being affected socioeconomically. And this is a graph that shows what industries we think might experience job loss and layoffs. First and foremost, people in the food and beverage services industry, clothing and retail, so on and so forth. So I think knowing that people in particular sectors will be more affected will become important for us to keep in mind. But the second most important thing, I shouldn't say second most important, but another more important thing is that we know what's happening is that the people who are losing their jobs tend to be low-wage workers compared to high-wage workers. The sort of exception is essential services workers. But in general, we see a lot of essentially economically precarious positions becoming more and more precarious. And so I think paying attention to the fact that people who are going to experience socioeconomic disadvantage are mostly those who are already disadvantaged. The other factor to consider is that socioeconomic disadvantage certainly isn't evenly distributed across society. I'm reminded from this figure of Diva Pager's important work, where she looked at the chance that you would get called back for an interview for a job based on your race and based on whether you have a criminal record. And on the left-hand side, you see two bars, and those are the callbacks, the chance that you'll get called back for an interview if you're Black or white and have a criminal record. On the right-hand side is the chance that you'll get called back for an interview and don't have a criminal record. And I think one of the most striking features of this study is that the rate of callbacks for whites with criminal records is higher than for Blacks without criminal records. So this notion that you're going to face a labor market that is already unkind, that phenomenon will fall disproportionately on Black and brown people. The other thing we think might happen is that the economic consequences of downturns are going to be more concentrated, sort of deeper through the socioeconomic distribution. We see college graduates, for example, who could otherwise expect to enter fairly well-paid positions who may no longer have those opportunities. And so we can anticipate that there may be some consequences deeper into the socioeconomic distribution. So how is this buffered? What do we do in the face of the fact that socioeconomic conditions set forth these trajectories for us? Well, one thing that really buffers this effect is family wealth. It's likely that if you come from a wealthy family who can support you in bad times, the effects on your health are going to be much more muted. And again, in this vein, we must consider the population groups that tend to have family wealth and those who have been deprived of accumulating family wealth. And that falls largely along racial lines. So the degree of wealth inequality will really sort of, I think, surface in terms of what we see going forward in health terms, because wealth will be able to buffer the blows, the socioeconomic blows for some and not for others. The other buffer we have is social policy, and we see debates about social policy happening right now. There are income supplementation programs that are being enacted. I think just yesterday or so, I heard this news that Steve Mnuchin thinks the $1,200 one-time payment should be good for 10 weeks. And we have a panel full of Canadians, so I think we can do the bragging on Canada for a little bit. in a much more generous income supplementation program, $2,000 a month, though with its own problems because of the large gaps in the benefit for certain subgroups in the Canadian population. And again, those subgroups tend to map onto race, ethnicity as well. On the right, I've just put a tweet from a friend and colleague, Tressie McMillan-Cottom. Someone points out how quickly the New Zealand subsidy was available. And she says, well, now you guys are just trolling us. Because our subsidies are so much less and so much harder to get. Social policy, again, in terms of wealth supplementation, is something to consider very strongly. We see that there have been proposals, especially over the course of the presidential primary season, in enacting programs like baby bonds, which are designed to reduce some of the wealth gap we see. This is a slide that shows the contours of something called the American Opportunity Accounts Program, which is a type of a wealth redistribution policy. And on the right is the predicted effect on the racial wealth gap. So you can see that with baby bonds, the difference between whites and blacks is predicted to be much lower, much more diminished than without a baby bonds program. So how will this mix of what your socioeconomic shocks end up being, whether you have family wealth and whether our societies decide to implement policies to help us overcome this, how will that all interact to shape health over the life course? I don't think we really know. I think it depends largely on how much economic disruption happens and how society responds in policy terms. This is just a figure that shows the other sort of part of that equation is whether we see latent pathway or cumulative effects. So whether the effects occur independent of how much we can recover in the meantime, whether they're accumulated over the rest of the life course, and so on. And this figure basically depicts a situation where over a life course, you have various positive and negative inputs. Services like school environments that are positive, access to healthcare quality, whether or not there's job insecurity experienced by a family. All of those kinds of things are going to play into what the trajectory looks like, but it's difficult to say exactly what will happen. I think the central issue is that we can imagine that there is going to be a lot more risk in the high risk trajectory. That inequality between people who are in the high risk trajectory group, which tend to have low socioeconomic resources, and the people who are in the low risk trajectory who have more resources and more family supports to their avail, that gap will likely increase due to the coronavirus pandemic and its socioeconomic shocks that have transpired. And I think that's what we need to be mindful of in the context of Life Course, and the best bet for sort of reducing that gap and reducing the risk that people experience is to act early and act in profound ways on income and health and wealth supports from the government. I'll leave it at that.
Excellent. Thank you very much, Arjumand. And now we're going to go back to Professor McClean, again with apologies to you, Catherine, and we'll start your slides back from the middle.
Great. So sorry about that. Can you hear me now?
Yeah, you're very clear right now. Thank you, Catherine.
Okay, great. I deeply apologize for the problem with the sound. Please let me know if you can't hear me.
No, right now it's very good. As one of the comments said, this is the new normal. That's okay. Please go ahead.
Thank you, folks. I really appreciate it. All right. I hope that maybe what I'll just do is I'll start from this slide. And I think that really I'm building upon what others have said. So I'm hoping this will be all right. So generally, there are many things that we think are impacted. To remind you, I'm just going to build on something that Professor Currie, what both speakers have said. I'm going to think about the new labor market entrants. So these are individuals who are currently entering the labor market. They are leaving school and they are going to join the job market, take on jobs, and what is going to happen to them across their life course in terms of their health. As I mentioned earlier, and I'm not sure if you heard, due to the problems with sound, what I indicated was there are many reasons to think that people who leave school and enter the labor market in a recession, not specifically the recession that may emerge from COVID-19, but recessions in general, they have worse labor market outcomes. They have lower wages. They work in less prestigious jobs. These effects are persistent. They are less likely to marry, more likely to divorce. These effects are persistent. So we're thinking about how these labor market and marriage market effects, these persistent effects that we observe across their life course, may impact their health across their life course. I'm going to follow a cohort of workers and see how these initial labor market shocks impact their health persistently. So why might this matter? Well, we think that health, we think that is affected by income. We think that health is impacted by employment. We think that health is impacted potentially by family formation, higher income, better jobs, more stable families are protective of health. And these factors are negatively impacted for those who leave school in an economic downturn, and the effects are persistent. So as I mentioned, we have experienced other economic recessions in the United States in the past 40 years. We may be able to learn something from the experiences of those individuals who entered the labor market during those economic downturns. Just to show you a figure where we have here, what I've done is I've used data from the Bureau of Labor Statistics, and I have plotted the unemployment rate in each year between 1978 and 2018. And I want to point out this early 1980s recession and then the Great Recession of the late 2000s. I'm going to look at workers who left before, who left the school and entered the labor market before, during, and after this early 1980s recession. I'm going to track them across their life course and see how these shocks in terms of their labor market outcomes and their marriage market outcomes can potentially impact their health behaviors, and their access to healthcare across their life course. I'm going to use a data set that is ideal to study these questions. It is designed to track these very outcomes across the life course in a cohort of workers, about 13,000 of them who left school before, during, and after the early 1980s recession. Again, I'm going to look at folks who entered the labor market right around this time period. So what I have done in a series of studies with some co-authors of mine is I've looked to see what happens to those individuals who left school and entered the labor market in this deep recession of the early 1980s. I'm going to track them in terms of their health outcomes through their late 40s and their early 50s. So what you can think about is you can think about two individuals. Person A, who entered the labor market in 1982. This was a bad time to enter the labor market. The unemployment rate was 9.7%. I'm going to follow them through to the late 2000s. Then I'm going to compare health outcomes for person A to person B, who entered the labor market, left school in 1979. This was a relatively good economic year compared to 82. The unemployment rate was 5.9, and I'm going to do the same thing and follow this individual. I'm going to compare health outcomes between A and B, and I'm going to control for factors about them. I'm going to say who is doing worse or better in terms of their health across the life course with this very large economic shock that they experienced at the labor market entrance. My colleagues and I, in a series of papers, have looked at various health outcomes. Broadly, I'll speak about men first because women in this older cohort are a little different, but I'll talk about them in a moment. But for men, in general, across a range of health behavior, and access to healthcare measures, we find that men have persistently worse health. They have worse self-assessed health, mental health, physical functioning. They're more likely to engage in risky alcohol use. They are more likely to have worse sleep. They have lower self-esteem, and they have less access to employer-sponsored health insurance. Interestingly, we find that they are less likely to be obese, They are less likely to use marijuana, and we don't see much change in terms of obesity and other drug use, other illicit drug use. We have lots of thoughts about why that might be, but in general, these individuals, like individual A, in terms of men, appear to have worse health when we follow them through their early 20s, when they're late teens, when they're entering the labor market, through to their 40s and 50s. So this is fairly persistent across the life course, these worse health outcomes. Women, interestingly, tend to, for some of the measures that we look at, tend to have somewhat better health outcomes, and I'm happy to talk about why that might be. We have some conjectures. So what does that mean for this current cohort of school leavers or labor market entrants, those individuals who are now contemplating entering a very risky, in terms of high unemployment rate, labor market? What does it mean for them? We think that, well, we think of the early 80s recession is potentially useful for thinking about these long-term health consequences. Of course, there are big differences. If we think about the recession that is likely to emerge from COVID-19, unemployment rates may be higher. We've heard unemployment rates up to about 20%. Government responses may likely differ. Our social program infrastructure differs. This is also the midst of a pandemic, which has widespread mortality and morbidity. With social distancing policies, which are well designed, but may induce other issues such as mental strain, isolation, so on and so forth. I think that we should be prepared when thinking about this cohort of school leavers, those entering the labor market at this time, that they may have experienced persistently negative outcomes in terms of employment, family formation, health behaviors, health outcomes, and so on and so forth. Thinking back to when I indicated that the findings for women were slightly different than they were for men, when I was leveraging the experiences of this cohort that entered the labor market before, during, and after the 1980s recession, I think given the transitions women have made into the labor market, we may expect that some of the patterns that we observed for men may be more informative for women today. What can we do? I think the other speakers have really given some great thoughts about things we might be able to do by thinking about these life course consequences in terms of other recessions where we've talked about how can we help these school leavers. You might want to think about trying to, if we can, and this is challenging, promoting job mobility across labor mobility, the ability to move to different areas where jobs are more plentiful, across different job types. Potentially some ideas about debt management when it comes to student loans. These are challenging questions, and these are big issues, but I do think we might need to think about the well-being of this cohort that is entering the labor market at this very difficult time. Thank you, and so sorry for the trouble with the audio.
Thank you very much. That was terrific. And thank you for prevailing despite the audio. Really appreciate it. So I'll invite the audience to send questions through the Q&A. I'm going to do a quick lightning round of questions, and I'm going to start with the first question. First of all, with thanks to all our speakers for outstanding presentations. So it's a grim picture that all of you paint. I must admit. So with that in mind, can I ask all three of you to make quick comments about next best steps to mitigate some of these consequences? Maybe we'll start from you, Janet.
Okay, well, I want to reiterate that I think this crisis is really underscoring the importance of programs like Medicaid and providing health insurance. There has been discussion, for example, of the possibility that one reason why Hispanics have been hit so hard is that people were afraid to go to the doctor. And so we're even less likely than other people to get treated. And of course, you know, the more untreated people that you have out there, the more it affects everyone. So the pandemic makes it really clear that as a matter of public health, you want everybody to be getting care. The thing that we see happening where hospitals are overwhelmed by patients, that's you know, happening very quickly. But we have, even in regular times, many people ending up needing a lot of medical care who wouldn't have needed it if they had been properly cared for, you know, from childhood. And so they have conditions now which they wouldn't have had otherwise. And so we need to think about that and really invest in preventing health problems. I also want to say I completely agree that preventing poverty is one thing that you can do to prevent health problems and improve people's health. And for people who are interested, the National Academies of Sciences last year put out a report that's called A Roadmap to Reducing Child Poverty, which talks about how child poverty could be reduced by half within 10 years, using programs that we already have or that our neighbors like Canada have. So it's totally within the realm of possibility. And if we had the political will to do it, it could be done.
Catherine, what are your thoughts on that?
I think I agree with all that was just indicated by Professor Currie. What I'd like to really focus on, if I don't disagree with anything she just said, I'd like to think about the new labor market entrance. I think that the idea of providing in terms.
It's fine. You're okay talking to your phone, yeah?
Okay, I hope I'm okay right now.
You're okay with it, yeah?
Okay, great. I think that thinking about providing protection in terms of debt management, that is for these new labor market entrants who are coming out with student debts, we might think about some ways to offering some management techniques to allow them a little bit of breather room as they make this transition into this very challenging labor market where there may not be the jobs that they thought were going to be there and that will help them pay down their student debt. I think that the idea of, as I mentioned, I'm just continuing on what Professor Currie just said, this epidemic is really highlighting the need for healthcare that is available to all of us. The value of Medicaid at this time, I really think can't be underscored for many people who need services. So I think that just would focus on those measures and agreeing with all that Professor Currie just said.
Arjumand, Professor Siddiqi.
Also agreeing with my colleagues wholeheartedly. I think the one thing I would add is that this may be a moment in time where you can see more bold action potentially being taken, potentially not. But I think as Professor Currie said, this moment is really underscoring the deficiencies we already have. And I think the size of the problem really requires very bold solutions. And I think that it would be a mistake to be worried about being too bold and instead to suggest exactly what we think we should have in order to have a labor force that's strong and secure, jobs that are well-paying and secure, and something that will deal with what is just an incredible amount of inequality in income and wealth at the moment.
Thank you. Let me ask another question from our audience, and maybe I'll start with you, Arjumand. Given the importance of these issues that you all raised, why do you think that there has been really very little conversation about any of this in the media?
Well, I'm not sure that there has been little conversation. I mean, in the sense that if you think about the income supplementation program that has been, quite a large topic, I think there's some reason to believe that we are having these conversations. What I would say, though, is that the media has shied away from the idea of bold policies. And in some ways, I think that's because for so long, we have been eating away at our social policies. We've actually been going in the reverse direction with less generous social policy, and we've almost lost our ability to sort of enter into the conversation, the notion that you would do anything much more than what we do and much more than what we've seen in the last few decades. In fact, I often say when we do research on the effects of social policies on health, I can tell you what happens when you decrease benefits and decrease income And I can guess from that what would happen if you were to increase it, but I can't directly empirically show what happens when we increase it because we just haven't been doing that. All our real world examples are of welfare state retrenchment. And so I think the idea is that there's been sort of a decline in the imaginary about what policies could actually offer us for our real world solution, our real world problems.
I really like the idea of we cannot think boldly. We cannot think boldly enough. We need to think even more bold than that. So thank you for that. Maybe I can ask this question to you, Janet, Professor Currie. The question is, what you're doing seems to be well within the realm of possibility. We need the political will to do so. So the questioner says, good. How does that happen?
That is a really good question. I think that I guess we all need to push, like not take no for an answer. I also wanted to point out that although I always feel frustrated that the media doesn't spend more time on these questions, I do feel that in this crisis, they've been doing a fantastic job, and they're as impacted as everybody else. And yet a lot of the stories that are coming out about deaths in nursing homes that weren't recorded, the death rates being so much higher for African Americans than for everybody else, those stories are breaking in the news and then affecting public policy kind of in real time. So everything is sped up. Or, unemployment insurance systems that are crashing because they're using 40-year-old software and they have to go and find people who can use these legacy platforms. And that's because we've made so little investment in not only in programs, but in government. Now we're expecting government to be able to do things for us when, they don't have staff, they don't have money, they don't have computers, they don't have ability to do these things. So I'm hoping that as more people become aware of these deficiencies, perhaps there will be more support for people who want to build infrastructure, not just bridges and roads, but the data infrastructure, the research infrastructure, the public health infrastructure that we need to prevent catastrophes like this going forwards.
Thank you. A question for you, Catherine, Professor McClean. Can you comment for a second about the compounding effect of trajectories for young people whose parents are also directly affected by job loss during the pandemic, particularly at the intersection of communities of color?
I think that's a very important question. You can kind of think about this as a sort of a sandwich effect for individuals who are beginning their careers and not having the choice or the ability to potentially have the job that they envisioned, maybe not working or working in a job that wasn't the job that they had an expectation and planning, this idea of this was going to be my life, my career, and then this very large unexpected shock occurs. And they're, doing the best that they can. And now if they are also experiencing parents who are potentially losing jobs, being furloughed, working less hours, whatever it might be, when we, in this current time, or when we emerge to something that looks something like the new normal, whatever that might be, I think, as I mentioned, trying to learn what we can from previous recessions is important. But I think the scale and the breadth of individuals who this current recession is going to impact is just much broader. We can think about these different factors. For example, parents who may also be facing these challenges as well, just sort of compacting or exacerbating this problem. And I think that you might think about what we've seen in the recession that I mentioned, that early 80s recession. We may think, and time will tell, but we may think the effects potentially could be larger. And when we think about communities of color or disadvantaged communities, I think that many of these, we could think about these issues being exacerbated even more. So it is a bit of a dire story as you mentioned, but I think it's something we need to consider and think boldly, as the other speakers have indicated. And just one comment that I thought Professor Currie made that was really insightful is that I'm hoping now that people can see the value of these things that are not just roads, but the value of public servants, the value of our public health workers. I think sometimes when people have so many things to focus on, it's difficult to think about all of these things. But when we can really see the lack of the computer programmers, the public health workers, I'm hoping that people will remember, the community will remember the value that we see in these individuals and their careers now, and hopefully we can go forward and continue to value them and invest in them so we're better prepared if this type of event is to occur again.
Thank you. We're running out of time, so I'm going to ask one last question to all the panelists, if I may. We'll go around quickly. Professor Currie, maybe we'll start with you. What's the most important open research question in this field in terms of the consequence of what's going on that we may be able to answer in the next couple of years?
I think the most important questions have to do with prevention and reversing some of these effects. So as Catherine was saying, the effects are felt in the body of all the things that have happened to you. And so the question is, how can we intervene to reverse some of those effects and help everybody to be in the best health possible?
Thank you. Catherine, Professor McClean.
I think along with sort of prevention, I think about what other public policies that we are potentially going with. We don't have a good infrastructure at this time. For example, I think there's a suite of policies, one of which I'm most familiar with is paid sick leave. This is something we've not had in the United States at the national level at any point in a permanent sense. We are one of only 3 OECD countries that does not have this benefit. With this coronavirus, the federal government has enacted a temporary paid sick leave up to 2 weeks for most private workers. So I think maybe trying to understand the benefit of being able to stay home during an outbreak of an infectious disease and potentially not suffer the wage consequences or as severely as we might without the access to paid sick leave. I think that's something that in the beginning stages of this pandemic, it was very challenging for many people to stay home because staying home from work when they were sick or when they were caring for an ill family member really meant foregoing wages because they didn't have access to paid sick leave benefits. And I think that's something that we can try and learn about through this recent Federal Families First Coronavirus Act and potentially using experiences from states and localities that prior to this federal act had policies in play that allowed workers who were sick to stay home and not spread disease to coworkers and clients and so forth.
Professor Siddiqi.
I think my question is philosophical, and it comes back to the political will question. And I think my question is, how will we reckon with the way we structure risk for poor health in our society? How will we come to terms with how much has been laid to bear by the coronavirus about who is more likely to suffer both from the illness and from the long-term consequences? And what does this mean for who we are as a society?
Thank you. Those are terrific answers, really outstanding presentations. I'd like to thank our speakers, Professor Siddiqi, Currie, and McClean. Thank you for your time. Thank you to everybody who joined us. And our next week, our seminar will be on media and how media affects the health of populations. Thank you, everybody. Thank you for being here. Stay safe, stay well.
Thank you.